Hello, and welcome to the Sanibel Symposium 2023 Expo. We're glad you're joining us here today virtually. We wish you could be here. There's a wonderful amount of information and networking and contacting that you could be doing while you were here, and we really wish you could have joined us. Today, we're going to talk about a few different things, but in the meantime, we're going to talk about the Maximus cell processing system. My name is Sean Browning. I'm here to represent ABT Medical, and this is the newest platelet-rich plasma medical device that you can reach from ABT Medical. In essence, this device is a closed system, sterile device for the production of platelet-rich plasma and platelet-poor plasma all in one sterile system. But it's a bit more unique than that. It incorporates a whole slew of clinical and other characteristics that you could use for your application. For example, it takes 50 milliliters of anticoagulated blood, and then it gets centrifuged into its various cell layers. The interesting thing here is that after you've centrifuged your blood, there's a adjustable inner part of the device that you can use to adjust it for your patient's hematocrit. As you know, women and men, they have different levels of their hematocrit, also based on their hydration. So when you want to tailor your PRP to have a certain red blood cell layer, you can dial it in with this adjustable cap. But it does more than that, because there are different types of PRP, and this device has a unique functions that allows you to incorporate various cells or not. In the lab, we usually talk about it as a cell wall effect that allows different additional densities, a finer tuning of cell fractionation that can be done with our device better than other medical devices. So inside this device, when you see the step-down approach as you get closer and closer to the hematocrit, this helps you fractionate the cells in a much better, much more efficient method. So it allows other types of PRP to be made. When you're done with the device, after the centrifugation, you can access it through this top port with a protected needle sheath to go in, collect all of your platelet-poor plasma, and then repeat the procedure with the red syringe to pull up your platelet-rich plasma. Now, you might note in some other devices, you might have to do a ring around the rosy when you're resuspending your platelet-rich plasma because the plastic keeps binding to the cells that you're trying to isolate. But with the plastic that we've incorporated in this device, that's not a problem. Quick resuspension, pull off your PRP, and it's there for your clinical application. However, once you have correlated all the cells you want to this inner portion of the piston of our device, of the Maximus device, you can tailor the final volume of it by removing various spacers. Pull off this spacer, and you've changed the final product from 7, 8, 9 milliliters down to 3. Take this one off, and you've gone even further into the device, and you can lower the final volume even further. Your platelet-poor plasma, your platelet-rich plasma, the best PRP and PPP that you can use for your clinical application. But if you really wanted to remove some cells, like no one really likes a lot of the red blood cells, there's a chance of hemolysis happening. Once you dial the device to slowly remove the red blood cells and trap it into the bottom chamber, like so, you can leave the platelets and white blood cells that you want in the top chamber, trap your red blood cells in the bottom chamber, and then it can't come out. So you can have a lot of confidence that when you're pulling up your PPP and your PRP, that you can remove the cells that you don't want as part of your clinical application. But we thought about this in other ways. Everything in our device is meant to make your job easier when you're doing this clinical application. Anything from just using the now sterile tray to hold up your device, or if you want to pass on the platelet-poor plasma or platelet-rich plasma to the sterile field, we have, not touching anything, closed system that you can use to pass on to the sterile field. So everything is meant, everything is done for your convenience. Make it easy on yourself. Use the Maximus PRP. If you would like to learn more about this product, you can get in touch with us at info@abtmedical.com. We have lots of information that we can share with you. We've been in this field for 15 years, I think, or more. In particular, we'll be happy to share with you our raw data where we have compared our device to other leading market devices that produce PRP or PPP. And to take it a step further, I've even summarized all the peer-reviewed literature that reports the cell concentrations for all of the products that you can find available. And you can see where we rank, how much product you'll get, and make an informed decision on what PRP device you'd like to use for your clinical application. If you are a perfusionist, and I assume you are if you're attending this wonderful conference, we'd like to share with you a peer-reviewed paper that has been published by Susan Eglerman, who is part of this symposium. In particular, it highlights the benefits of using a PRP gel for perfusionists who are doing various cardiovascular things. They use this to help with blood clotting and reduce loss. And in particular, we're happy to share this paper with you. You can get a copy of it. You can see that after the use of gel clot, there between a control group and a group that used PRP gel, there was less blood loss and less time spent in the ICU. So overall, I think the message you should take from this presentation is this PRP device produces an excellent platelet-poor plasma, platelet-rich plasma, where you can use the device to tailor as you need for your clinical application the cell concentration. Please contact us at info@abtmedical.com, and we'll be happy to talk with you further. Thank you very much, and we hope you enjoy the Sanibel Symposium 2023 and can join us again next year.